So just in case there's another editor, would you please say and spell your name on camera for us, and then also tell us what your title is?
My name is Dawn Sidell. Dawn is D-A-W-N, Sidell, S-I-D-E-L-L, and I'm the Executive Director of Northwest Autism Center.
Okay. So for these first few questions, we're going to go a lot over what is autism.
Oh, you want? Oh.
Yeah. What is autism?
Watch out for lunch.
Yeah.
Autism is a neurodevelopmental disorder characterized by challenges in communication, socialization, and behavior.
Keep going. Yeah. You can expound on that.
It's a spectrum disorder. So although there are core characteristics that you can typically identify in children and adults, how significant they are and how they do or do not impair functioning varies widely. So currently the DSM-5, which is the manual used for describing diagnoses for mental illnesses, has a new definition. It came out in 2000, I think it was 2013, for autism spectrum disorder that now incorporates what we formerly understood to be Asperger's. So Asperger's was taken out as an actual diagnosis. Of course, you'll still hear the term used, but I think that the intent was to try to minimize mistakes made in identifying and diagnosing. Their providers are still pretty inconsistent in the conclusions they come to when they make those evaluations. And when you incorporate it into a spectrum disorder, there's less of a chance then of missing individuals who have it but don't express the symptoms in the same manner. I think that the communication and socialization piece is pretty significant because it can be a very isolating piece for individuals with autism. And it's very challenging to find ways to help individuals communicate. If they have sensory issues, if they have difficulty with fine motor skills, these can all contribute, as well as any impairment in executive functioning will all contribute to their challenges in communicating what they need, what they want, what they dream of, and helping them navigate their world.
Tell us a little bit about the statistics that are out there now. Are we seeing an increase?
The last statistic that came out from the CDC, the 1 in 68, has stayed relatively the same. So the most recent report we got from the CDC indicated that there hadn't been another jump. But what they did find was that
and that's okay, you can stop right there.
yeah, let me stop a second and think about this.
Let me second.
Yeah.
And
So tell us about the CDC report.
First of all, it's the public getting to hear the statistic is about 4 years removed from when the data was actually collected. So there's that stagger in the information when it was done, and then when we as a population get to hear about it. Different studies, currently the approach that's used relies on a records review. So the more records that are available to review, the more accurate the number would be. So for instance, if you don't get access to school district records, you might miss children who have been diagnosed but only through their public education system and not, maybe they're not on the developmental disabilities rolls or whatever. So it can cause a difference in the numbers that come out. I think that the bigger question is, because we get asked this all the time, is the increase real? Or is it because we are identifying and diagnosing more accurately? And I believe it's a combination of both. There's research that accounted, some sort of a formula that's accounts for the increase and the co-occurring decrease in other categories of like developmental delay and intellectual delay. So, but that's not enough to account for the actual rise. I know that just from an experiential viewpoint, there are teachers who will tell you that they had a kid that fit the description of autism maybe once every few years in their classroom. And now they're getting 3 or 4 every year. And physicians, same thing. Some of our local providers will say that, 10 and 15 years ago, they might go a few years without seeing a child that fit that description. And now they are having to do evaluations and screenings and diagnostic workups on several every month. So I think there is an actual rise, and we still don't know why, although I'm encouraged that more federal research dollars are going into epigenetic research as well as environmental research instead of just genetics. I mean, they're all important, right? But we have enough information to understand that there's a genetic predisposition and some kind of environmental trigger. It's almost like with cancer. You may have parents, grandparents who had cancer. You may have environmental habits that would contribute to you getting it, but you don't. So there's no guarantee. We can say that your chances are higher that you will if, but we don't know for sure in most cases whether or not you would get it, or how severe it would be, or where it would hit you, and all of that. And autism is very similar that way. We don't know how to predict it, and we don't know where on the spectrum the child might land.
What are some of the parents who come to you guys saying whenever they finally recognize that maybe something isn't right with their baby, and that's when they go and get a diagnosis? What are some of the things that you hear from parents who actually go to the doctor and say, oh, they're not doing this, and they're not doing this, and they're not doing this? What are some of those things that parents, new parents might not know that that's what's supposed to be happening? Parents who have a second child normally know that, but... It's changed a great deal in the 15 years that we've been operating. I think in the beginning, it was extremely difficult to find a physician who felt comfortable and knowledgeable enough to do the evaluation and the diagnosis. So if a family suspected that their child had delays, and might even suspect that those delays indicated that the child might have autism, they would have a terrible time, often, finding someone who could make the diagnosis. The child might go years without one. And this was real frustrating, I think, for families, because the approach used to teach and care for children with autism really, if you have strategies that address the core challenges to that disorder, your chances of being successful with learning and skill development and even providing other therapies like speech therapy, physical therapy, occupational therapy, if you understand what the core characteristics are that's causing the delay, then your approach is going to be markedly different, and certainly should be, because conventional approaches in those areas were not very successful with our kids. But now, more and more physicians are indeed able to do the screening early on. So families frequently now, they come to us and they already have a diagnosis, whereas before they frequently did not, and were looking for a physician who might be able to help them do the diagnosis and then provide ongoing treatment. So what does Northwest Autism Center do?
We certainly provide direct services, but it has, to me, that is not the, to me, it is not the most important service that we provide. The success of any organization, I think, is dependent on its willingness and ability to integrate itself into the surrounding community and make a difference for other organizations as well. So there has been over the years a growing awareness of what autism is and how it can impact a child and then, of course, an adult's life and their ability to function and navigate their environments, their school setting, their jobs, their day-to-day work. Some of those individuals require significant supports, and some do not. It is important, whether you're talking about education or healthcare or mental health, to have a voice at the table that is representative of that population, because many of the kinds of care and services that each of those disciplines provides is ineffective in helping children and adults with autism. So for example, if you do not have the strategies to help a child with autism in the healthcare system, they will frequently not get the kind of health care that they need in order to be optimally healthy. So I have heard many families express frustration with the healthcare system's inability to meet their child's needs or to do an appropriate evaluation of a co-occurring medical condition. And hospitals aren't typically set up environment-wise to accommodate many of the needs of these children. So it can be an incredibly trying experience to have any kind of a hospital, procedure. I think that my hope is that as we continue to discuss these issues and talk about reforming policies and approaches both within public education, healthcare, and mental health, we'll stand a better chance of meeting the needs of these individuals and reducing the impact, the significant impact that co-occurring conditions have on their health and their state of well-being. So I believe Northwest Autism Center is one of our biggest contributions is to continually participate in those conversations and to try to start, moving the needle in a positive direction for our kids, adults, and families. Currently, the age.
Now start. Go ahead.
Okay. Currently, the American Academy of Pediatrics has stated that the diagnosis of autism can be made as early as 18 months. And we're still not there yet. Nationally, it's around 4 to 5. The national average age of diagnosis is 4 to 5 years. So we still have a lot of work to do to catch children early, because the earlier they're caught, the more successful providing that early intervention can be. So it's important to keep moving in that direction, but we haven't. We've done a better job of improving detection in Hispanic and African American populations, but we haven't improved the overall age of diagnosis across the board for everybody. So it is promising that they continue to look at how to do diagnosis even earlier in infants. And what I find even more promising is that they're looking at biomarkers. So instead of having to rely on observation and parent interview, you could come up with biomarkers that would help you make a more definitive diagnosis at an earlier age. So the eye tracking studies are incredibly compelling. How do infants who have autism or who later develop the diagnosis of autism get the diagnosis of autism? How does their eye tracking differ from infants who do not later get the diagnosis? So that would be a biomarker. That would be something that you could do early on. But these studies take time, and then replicating them for large populations, that takes time as well. So even though there's a lot of discussion about this promising area, it's still not a mainstream practice yet because we don't have that kind of information. So we're still in the stage of collecting it.
Good. If a parent was to talk, you have a son with autism, if you were to counsel a parent about, you do well, you don't do diagnosis, but you kind of measure and kind of observe and can kind of help screen for a parent. What would you tell a parent who has been told your child has autism? And what happens when they come to your organization with that diagnosis?
For new parents who have just received the diagnosis, I think probably the most important message is that it's not a prison sentence or a death sentence. It is an opportunity to be informed in the way that you go about raising your child and advocating for them. Knowing that there are other parents who are experiencing similar challenges and being able to connect with them is huge. When I moved back to Spokane in 2000, one of the first groups that I became involved with was Autism Society of Washington Spokane chapter. And it was extremely helpful. They had materials and information and brochures, that they would share with parents that came to meetings, and they held support group meetings once a month. Still do. And those were, it's extremely helpful to know how other people are managing. So Northwest Autism Center, in that regard, provides a similar service. We don't have support groups, but we are a place to call for information, local resources, and every day you can call and somebody will answer the phone and provide that information. I think that I'm always a little bit surprised at messages that families get that are inaccurate. Sometimes they are told disheartening things and given sort of prognostic information that is also inaccurate. You really don't know if a child is going to need significant. I mean, a lot of times they may have challenges that require significant supports at 3, 4, and 5 years of age, but then they may do so well that they become what's called indistinguishable from their peers. They're so responsive to early intervention that they make tremendous strides, and then they don't need such significant supports as they grow older. And I think that not just families, but the community at large needs to remember that. It's extremely important to try to give the tools, the child, every tool that you can to help them make the best of what they've got, And sometimes it can be really remarkable. We have families who are so surprised by the progress that their child makes once they are given the appropriate intervention that they're kind of dumbfounded, quite frankly, about it. Children who learn they're like sponges, they soak it all up. And it is very rewarding to hear families say that it changed their lives, that they can't believe their child can now communicate or can now go out to dinner with them or be with their extended family. These are all huge milestones in a child's development that families often struggle with in those initial years. And I think that regardless of whether your child got diagnosed with autism or some other disability or didn't get a diagnosis at all, you are always trying to help them be the best that they can be. And autism doesn't change that. It doesn't change that journey. It just happens to be the particular challenge that you and your family have.
This is helpful whenever you're editing, to start and stop it on different points.
I'm rolling again.
What are you hoping to do with these videos that we're creating for you?
I hope that these videos will help increase awareness in the general public about autism spectrum disorder. I hope that they will help change misperceptions and inaccuracies. I hope they'll clarify points. It makes me nervous when to hear that families are told that applied behavioral analysis is a treatment that they should not pursue for their child, or that it will be harmful or have a negative impact on their children. Thankfully, we provide tours for families who are interested in the services that we provide, and we also have observation windows for each treatment room so families can stay and observe what's going on. 100%. The ones that have been told negative information about the treatment approach have been astounded not only by the fallacy of that statement, but by the almost missed opportunity to actually provide a treatment that worked. Their children will progress to such an extent that they're really quite dumbfounded that they ever considered not coming. So it makes me extremely sad to hear that is still a perception that exists. And so I'm hoping that the videos help to alleviate some of that problem.
Tell us, what are the rewards you get from, you created the center, you developed it, it's your baby, you had help along the way, yes, but this is your passion. So what are some of the rewards you get from doing this? And do you want to answer that question?
No, I'll answer it. Sometimes I get asked, what are the rewards that I get or got from founding, I get, for lack of a better word, Northwest Autism Center, and being able to be part of its growth and expansion. I suppose the biggest reward is knowing that I have found a way to have a voice at the table that will alter, in a good way, the fabric of the community for my son and for other children as well. My son is 23, the one that has autism, and he does not directly benefit from the services that Northwest Autism Center provides. But he lives in a community that benefits from the services that Northwest Autism Center provides, whether it's in training, information, policy advancement, direct service provision, early intervention, efforts like this that helps to illuminate what autism is and how it impacts individuals. These are all things that will positively impact the world in which he lives in. Anytime people have a deeper understanding of my son's disorder, they do a better job of caring for him and advocating for him. I think one of the biggest concerns that I have is the risk, and some of it's already happened, unfortunately, of the media capitalizing on that portion of the autism spectrum that is very small. So individuals who have savant abilities and are able to hold jobs very high-paying, very demanding jobs, while still experiencing the challenges that autism brings, the percentage of the population is quite small. Over half of individuals with autism have some kind of a intellectual delay. Something like 40% can't speak, and their not being able to speak is not the only communication issue. My son has to have 24/7 care every minute. Like, he has to have that kind of care. And he is not a small percentage. He's a big percentage. So when the public starts to believe that autism is characterized by kind of an odd quirkiness, and if we as a neighbor, friend, and family would simply just be loving and inclusive, everything would be fine. That's a dangerous message, because it implies that you don't need specially trained people in the healthcare community or the mental health community or the public education system. It implies that you don't need to allocate financial resources to residential services, crisis centers. It's a very... I get very nervous about seeing people's minds move in that direction, because it is it's not true. So I'm hoping that KXLY's partnership with the Northwest Autism Center in making these videos available and this information available will help change that as well, or alleviate it some.
Teachers first, the educational community. How is that going? Have the conversations been more open? Are more people open to saying, oh boy, I think this child might have some special needs. So let's talk about where you've gone with the educational community from maybe 10 years ago. And what your hopes would be for the future.
I think that the public education system's understanding, and private, that the understanding around the significance of autism in providing educational services needs to be acknowledged, and it will indeed impact the kind of supports and the kind of IEP, individualized education plan, that would be created for that student. I think in the last 10 years, some of the things that have changed is that there's a greater acknowledgement that that's the case. Unfortunately, some of the things that haven't changed is there's still a very limited understanding of what services in an educational setting need to be provided and how to do it in an inclusive way. It is not only children with autism who experience that deficit in public education. We have for years not come to grips with our change in policy. So what was it, in the 70s when we decided that all children had the right to an education? And that's not that long ago. Under IDEA, the Individuals with Disabilities Education Act, there are several things that were promised to students with developmental disabilities, including autism, and they are not currently implemented. across the board. But the federal government also promised to fund IDEA up to 40%, and they're around 17. So school districts are left mandated to educate students regardless of ability, but they're not really given the resources to do that. So, so progress in that area has been woefully behind. It's just woefully behind.
What are you currently doing to try and address that
I
as
know,
much
I
as
was
you can?
trying to decide whether to talk about the disproportionality rates or not, and I'm like, I don't.
Yeah. What are you as a center doing with
Mhm.
education?
Our Director of Clinical Services has provided training to teachers, paraprofessionals, administration in local school districts and rural school districts. We wish we had more employees to offer because the need far outweighs what we have the bandwidth to provide, but we do that. We also frequently volunteer our time to participate on advisory committees that are tasked with evaluating, assessing educational processes in different schools and school districts. And we try to not say no when we are asked to do those things. Sometimes training is definitely a must in any area, whether you're talking about autism or other developmental disabilities, or you're talking about broad concepts like restorative practices, positive behavioral intervention supports, PBIS. These are all very worthwhile, inclusive approaches that take time to train to. The training is only one piece. The on-site coaching, implementation, and oversight, that has to happen as well. And frequently doesn't, either because of a lack of will or a lack of resources to do it. So it's real challenging, I think, for districts to try to turn that ship around on their own. And the extent to which they're willing to ask for or invite outside help and consultation is really critical. It's very important. But they don't have the resources to do it. One of the things we try as a nonprofit is to bring in funds that help us beef that up and or make the services affordable to districts so that they can. Yeah, so that's...
You serve on a variety of medical task force too. We had some conversations about hospitalizations, emergency rooms, all those types of things. So what is taking place on that front right now?
I do serve on several different kinds of healthcare committee, task force. I mean, if they're having a meeting and I get invited, or I know about it and I can invite myself, I will. I went to one recently, the psychiatric care collaborative meeting, and it was addressing challenges that we've been trying to address through different committee work regarding mental health and behavioral health issues in our community. A lot of the services that are provided through the mental health system First of all, we already know there's not enough, even in the current landscape. And sadly, secondly, what is provided is not most of the time appropriate for neurodevelopmental disabilities. So individuals with autism who are experiencing some kind of crisis that may bring with it behavioral issues that are cause aggression, self-injury, property destruction. The conventional approaches used for the in mental health service provision are largely ineffective for those with autism. And so are the medications, and so are the environments. So until we really have a concerted effort that specifically targets that population, and I mean autism and other neurodevelopmental disabilities, we will continue to see what is now a national phenomenon that is appalling and horrific. So many adolescents and adults ending up in emergency rooms, hospitals, and staying there not just weeks at a time, but months at a time, undergoing both medical and physical restraint and not having a place to go. It is getting worse, and it's not just happening here, it's happening all across the country. So our medical community has got to partner with our Developmental Disabilities Administration in order to address the issue and begin to reduce this problem and hopefully extinct it. It is heartbreaking to watch what happens to the adolescents and adults who find themselves in this situation. Hospitals are not equipped to care for this population. They just are not. And yet, we have not created another place for them to go. The judicial system is another environment where they can be tangled up in, housed in, and one of the things that we provide as requested is training, crisis intervention training for our local law enforcement. We also will provide an experience for their advanced CIT training, so officers who choose to can spend some time at Northwest Autism Center and with our families and with the children in order to get a better understanding of what that disorder means. And you can get practical advice on strategies for approaching someone who might, first of all, being able to recognize the signs and symptoms of autism if they see it, and then getting some strategies for how to approach an individual who has it. There have been some really sad stories in the news, not here locally, I'm happy to say, but across the nation, where law enforcement didn't accurately. They think that the teenager has, some sort of drug psychosis going on, and what they really have is a perseverative, issue that's part of their autism and doesn't have anything to do with drug use. But the next thing you know, they're cuffed, they're down, and they're in jail. And those kinds of experiences create unnecessary trauma then that impacts, obviously, that teenager's ability to move forward and recoup. But the sad part is if they don't have somebody to advocate for them, they might languish there for quite a while. They don't have somebody who really knows how to rescue them from there. So obviously the desired goal is to prevent those kinds of horrible things from happening in the first place. And you do that by educating. And you can't just do it once. You have to do it every year or every quarter It's an ongoing, because with every season you have a new, influx. We have practicum agreements with all of our local universities so that students can get some hands-on supervision experience with us. And I think that we're looking at ways to provide that in the medical school as well. So helping students who are going to be providers of medical services, physicians in our own region, helping them to understand the disorder early on before they've ever even graduated it's just going to have to happen, because it doesn't matter what kind of a physician you are, you're going to experience providing care for somebody with autism. You're going to have that experience. And you're not going to be able to do a very good job at it if you don't know anything about the disorder. And it doesn't matter if you're a gastroenterologist, a neurologist, a family practice doc, a pediatrician, a dentist, an optometrist, all. And it is, I was about to say unfair, but it's possible that it's not even ethical to imagine that you do not have a responsibility to the population of children and adults who have disabilities. It is everybody's responsibility to provide care for those people, not just Dr. Joe Smith, who decided to make it his calling in life. And what all too often happens is that physicians who do have a skill set and an inclination and a passion around serving the population of individuals with disabilities, they don't make a lot of money. It takes time to serve that population. The reimbursement rates, if they have public insurance, can be so miserably low that you can't break even. And so nobody wants to provide that care, and they say, well, I'm not very good at it, I don't know how to do it. Then go find out how to do it. Because it is an unnecessary burden then to take advantage of those who are doing it. Everybody should be doing it to some degree, and they're not. There's a handful of dentists, for instance, who are comfortable treating kids with autism, and therefore a very large portion of their practice becomes those individuals because they can't get care anyplace else. And while I am grateful beyond belief that those physicians, dentists, optometrists exist, I am appalled that we do not have a sense of shared responsibility amongst every provider in the profession.
We're going to